Healthy moms, healthy babies, tackling anemia in pregnancy. Pregnancy is one of the most beautiful and transformative times in a woman's life, but it comes with its own set of challenges and responsibilities. One important aspect of a healthy pregnancy is ensuring that your body has all the nutrients it needs, not just for you, but for your growing baby, too. Among these concerns, anemia stands out as a common issue. It happens when your body doesn't have enough healthy red blood cells to carry oxygen to your tissues and to your baby. This can make you feel tired, weak, and less energetic than usual. But the great news is that there are many effective ways to prevent and treat anemia during pregnancy. Let's start by understanding why anemia is so common during pregnancy. When you're pregnant, your body's blood volume increases significantly to support the baby's growth and development. This means your body needs more nutrients, especially iron, to make extra hemoglobin for your blood. Hemoglobin is the protein in red blood cells that carries oxygen. Without enough iron, your body struggles to produce enough healthy red blood cells, and this leads to anemia. The condition can develop gradually, and sometimes you might not even realize it at first. One of the most important steps in preventing anemia is making sure you're eating a balanced diet rich in iron. Iron is the key nutrient your body needs to make hemoglobin. So, what foods should you focus on? Green leafy vegetables like spinach, kale, and collard greens are fantastic sources of iron. Legumes like lentils, chickpeas, and kidney beans are also packed with this essential nutrient. If you eat meat, lean red meat is an excellent source of heme iron, which is more easily absorbed by your body compared to non-heme iron found in plant-based foods. Seafood, such as shrimp and salmon, can also be a good source of iron. And if you have a sweet tooth, you'll be happy to know that dried fruits like apricots, prunes, and raisins contain iron as well. Even nuts and seeds, such as almonds, cashews, pumpkin seeds, and sunflower seeds, can give you a helpful boost. It's a good idea to include a variety of these foods in your meals throughout the week. Now, here's an important tip to keep in mind. Eating iron-rich foods is great, but your body might need a little help to absorb all that iron. This is where vitamin C comes in. Foods rich in vitamin C, such as oranges, strawberries, bell peppers, tomatoes, and even broccoli, can significantly enhance iron absorption. For example, if you're eating a spinach salad, you can squeeze some fresh lemon juice over it. Or, if you're having lentils or beans, consider pairing them with a side of orange slices or a glass of fresh orange juice. These small changes can make a big difference in how much iron your body actually absorbs. While iron is essential, it's not the only nutrient you need to prevent anemia during pregnancy. Folic acid also plays a critical role. This vitamin is especially important in the early stages of pregnancy because it helps prevent birth defects in your baby's brain and spine. But did you know it's also important for preventing anemia? Foods like avocados, asparagus, broccoli, and fortified cereals are rich in folic acid. If your doctor has prescribed a prenatal vitamin, it likely contains folic acid to make sure you're getting enough. Speaking of supplements, they can be a lifesaver during pregnancy. Even with the best diet, it's sometimes hard to get all the nutrients you need, especially if you're dealing with morning sickness or food aversions. Your doctor may recommend an iron supplement, a folic acid tablet, or a complete prenatal vitamin to fill in the gaps. If you're taking an iron supplement, it's best to take it on an empty stomach for maximum absorption. However, if it causes stomach upset, you can take it with a small meal or snack. Drinking enough water is another important factor that often gets overlooked. Staying hydrated helps maintain healthy blood flow and supports the increased blood volume your body needs during pregnancy. Make it a habit to carry a water bottle with you and sip throughout the day. If plain water feels boring, you can add slices of lemon, cucumber, or mint leaves for a refreshing twist. Now, let's talk about what to avoid. Certain foods and drinks can interfere with your body's ability to absorb iron. For example, tea and coffee contain compounds called tannins that can block iron absorption. So, if you're a fan of these beverages, try to enjoy them between meals rather than with meals. Similarly, calcium, which is essential for your bones and your baby's development, can also reduce iron absorption. You don't need to avoid dairy products, but it's a good idea to consume them at a different time than your iron-rich meals or supplements. Recognizing the symptoms of anemia is just as important as preventing it. Some common signs include feeling unusually tired, having pale skin, shortness of breath, dizziness, or even an increased heart rate. Sometimes you might experience cravings for non-food items like ice, dirt, or chalk. This condition, known as pica, can be a sign of iron deficiency anemia. If you notice any of these symptoms, it's crucial to talk to your doctor. A simple blood test can confirm whether you have anemia and guide the next steps for treatment. If you're diagnosed with anemia, don't panic. It's a common condition during pregnancy, and there are many ways to manage it effectively. Your doctor may recommend iron supplements, which can take a few weeks to show results. Be consistent with them, and if you experience side effects like constipation or nausea, let your doctor know. They can adjust your dosage or suggest alternatives, such as liquid iron or a slow-release formula. In some cases, if anemia is more severe, your doctor might recommend an iron infusion. This is a procedure where iron is delivered directly into your bloodstream. It works much faster than oral supplements and can be a good option if your levels need to be corrected quickly. While the idea of an infusion might sound intimidating, it's a safe and effective treatment. Taking care of your mental and emotional health is just as important as addressing physical symptoms. Dealing with anemia, or even the fear of it, can be stressful. Remember, it's okay to ask for help and lean on your support system. Share your concerns with your partner, family, or close friends, and don't hesitate to reach out to your healthcare team. They're there to support you every step of the way. Your eating habits can also make a big difference. Instead of 3 large meals, try eating smaller, nutrient-dense meals throughout the day. This not only helps with nutrient absorption, but also keeps your energy levels stable. Snacks like boiled eggs, nuts, or a piece of fruit can give you a quick energy boost. Gentle exercise can also be beneficial. Activities like walking, swimming, or prenatal yoga can improve blood circulation, which helps deliver oxygen and nutrients to your baby. Always check with your doctor before starting any exercise routine, especially if you're dealing with anemia. Regular prenatal checkups are crucial. These visits allow your doctor to monitor your blood levels and catch any issues early. If you're at higher risk for anemia, such as carrying twins or having a history of anemia, your doctor may recommend extra precautions. Finally, don't underestimate the importance of rest. Pregnancy is hard work, and dealing with anemia can make you feel even more tired. Listen to your body and take breaks when you need to. Resting is not a sign of weakness. It's a vital part of taking care of yourself and your baby. Anemia might seem overwhelming, but with the right care, it's manageable. Focus on eating well, staying hydrated, and following your doctor's advice. Remember, every small step you take is a step toward a healthier pregnancy and a strong, thriving baby. You're doing an amazing job, and you've got this.